In this lesson, we're going to be talking about lower body push exercises, bilaterally and unilaterally speaking, as well as a few different strategies for lower body prehab. So our lower body push, the primary muscles that we are seeing use are our quads, our calves, and our glutes. I put the calves and the glutes in asterisk because those also can be felt or activated during pulling exercises as well. So when we talk about lower body push exercises, we're going to also refer to those as knee or quad dominant exercises. So these are exercises in which the quadriceps are serving as the primary mover. So those are different from hinge exercises. So those would be hip or hamstring dominant movements. So knee or quad dominant is going to be more like your squat, whereas a hip and hamstring dominant are going to be more like a deadlift. Bilateral lower body pushes, we have the various forms of squats, whether that be body weight, goblet, kettlebell, front, back, or safety. We also have our leg press. So if we're looking to maybe work with injured athletes and they're not quite ready for squats, but we do want to kind of progress them in bilateral pushes for the lower body, a leg press would be a great option, as well as just things like calf raises and variations. Depending on the angle, we might want to point our toes in. We can have our toes straight on, or we can have our toes pointed out. Is going to target different portions of our calves. Some unilateral lower body exercises, we can do a variation of split squats from our body weights all the way up to our safety bar ones, a Bulgarian split squat in which we have our rear foot elevated. So that back foot is up on a bench. Our shoelaces are on the bench as that front leg is squatting up and down. Our lunge, we can go walking or in place. We can also do reverse lunges, crossover lunges, which is what we see here. Sometimes those are called curtsy lunges. We can also do step ups, step downs, and single leg calf raises. So some different lower body videos that we see here. I'm not going to actually watch these in this one. You should have the PowerPoints available to you on Brightspace. These are just a little bit more time consuming, and I want to kind of be respectful of your time in the sense of this video. So feel free to go back and watch each of these if there's a movement that you aren't familiar with. Different from the upper body movements, our lower body movements are going to be pretty much not labeled as horizontal or vertical, because most of them are going to be fairly vertical. When we talk about balance within a lower body aspect, we're going to be talking about a balance between pushes and pulls, as well as bilateral and unilateral. So a little less to think about, but a little bit more important than the upper body, because these are bigger, more powerful muscles performing bigger, more powerful movements. Some lower body prehab and mobility work, as opposed to the upper body. These tend to be a little bit more, I think, universal across all different sports. So looking at where the most injuries happen, oftentimes we start from the bottom up, ankles, knees, hips. It is interesting to see when somebody has various injuries, more often than not, it actually starts with the ankles and works its way up. So if you have a shoulder injury, sometimes, not always, but sometimes that can be a result of ankle issues that weren't addressed earlier. So ankles, most of the time we're just trying to improve the dorsiflexion on that, but we also look at a lot of different other aspects. So things like ankle wall dorsiflexion, banded dorsiflexion, all four angles. So dorsiflexion, plantar flexion, as well as inversion and eversion with a four-way banded ankle mobility, and then an ankle dorsiflex to calf raise. Knee-wise, we can do a banded TKE or terminal knee extension, in which we have we're in a standing position. We attach a band to maybe a dumbbell rack, something heavy that won't move, and we put the other end of the band around the back of our knee. And from there, we go ahead and let our knee kind of flex a little bit, and then we go to extend it. We really squeeze our our quads like crazy, particularly firing up the VMO, that big teardrop portion of your quad on the inside of your leg. Single leg squat to bench, just learning how to control our body, really tempoing those, maybe 4 seconds down, tap on the bench and come back up. We can do a squat off bench. We can do a crossover squat off bench, step up, step downs, and sissy squats, really targeting the quads and the muscles around the knees. Hip wise, we can do things like fire hydrants, variations of 90-90s, and so on. So if you have the equipment, once again, I don't expect really anybody to have a safety bar. You can go ahead and try these different movements. Make sure you're viewing those videos if you are unsure about some of them, and do some research on your own.